My name is Sequoia. I'm a nurse practitioner student with Clarion University. How are you?
Good.
And your name is?
Cheryl.
And I'm going to be doing your physical exam today, okay?
Okay.
I just sanitized my hands before touching the patient. She's been resting for about 10-15 minutes now. So at this point, I would check her blood pressure with her bilateral arms to her side. And comparing the two blood pressures on each side, we would make sure that we did it on the skin with the sleeve rolled up. And for the video purposes, let's say that her blood pressure was 120/60 in both sides of her arms. So next, I'm gonna assess her skin. So just looking at her, I can see that her skin is pink. It's nice, warm, and dry. Looking at her fingernails, I don't see any cyanosis or clubbing. And she also has a good capillary refill of less than 3 seconds. What I'll do next is feel for her pulses. So I'm gonna start with her carotid, using only my 2 fingers and comparing each pulse for each side. Next, I'll feel her brachial pulse. Then her radial. Moving down to the popliteal pulse behind the knee. Posterior tibial pulse. And dorsalis pedis. All of her pulses are equal on both sides. They have a 2+ and a rate of about 72 with a normal sinus rhythm. There's no bounding noted on any of her arteries. So next I'm going to inspect her eyes without using my ophthalmoscope yet. So if you could take down your glasses, please. So looking at her eyelids, I don't see any abnormalities. There's no lacerations or styes. If I pull down her lower lid, I see that they're nice and pink, which indicates she's not anemic. Looking at her sclera, her retina, iris, and pupils, they're both equal. There's no drainage, there's no redness or swelling. The patient declines any itching or burning and any blurry vision. And then her eyes are even with the pinna of both ears, and they are symmetrical. So next I'm gonna assess her eyes using my ophthalmoscope, and I'm going to dim the lights for the video purposes. And standing about 3 feet away with the lights on, I'm going to assess her red reflex and make sure it's present. So her red reflex is present in both eyes, which is a good sign, and I'm going to turn the lights back on. So now I'm going to assess her retinas. About 2 to 3 inches from her face, I would use my right eye to look in her right eye and my left eye to look in her left eye. I can't see out of my left eye, so I'm going to use my right for both. So coming real close and inspecting the retina, the media. The media is the clear area of the eye that light can pass through. And then I'm going to assess her optic disc and optic cup. And they are about 3 millimeters medial to the nose. Look straight. Okay. So her optic disc and her optic cup are both intact. The optic disc is also known as the blind spot because of the lack of photoreceptors, and then the optic cup is like the depression in the optic disc. So next I'm going to look at her macula, and this area is right in the center of the retina, and it's like an oval shaped dyspigmented area. Okay, both macula are, they look good, they're even, and there's no indication of macular degeneration. So next we're going to assess her cranial nerves. So the first one we're going to assess is the cranial nerve 2, which is the optic nerve. Doing that, we're going to use the Snellen chart, and I just have a small one here. So this one we stand about 6 feet away, and she's going to put her glasses back on and cover her left eye. And on here, what line are you able to read?
E, F, T, E, D.
So that was about 20/30 vision, and I'm gonna have her switch her hand to cover the other eye. What line are you able to read now?
There's a glare on it. Okay, that's better. C, F, D, H, J.
So that indicates she can see 20/25 in the other eye. And then with both of your eyes, we're gonna do it one more time.
There's a glare on it again. Okay. L, T, F, P, H.
And with both her eyes, she has 20/20 vision. And the other test for the cranial nerve is to hold up my fingers in her peripheral view. I'm going to cover the same eye that she covers and make sure that she's able to see how many numbers I'm holding up. So cover your right eye, and I'm going to cover my right eye. Now, how many fingers am I holding up?
2, 2, 3, 3.
Okay, we're going to switch eyes.
I can't see it. 2, 4, 5.
Okay, good. So the optic nerve is intact. Next, we're going to check for cranial nerves 3, 4, and 6, which are the ocular, trigeminal, and abducens. This one, I'm going to have her follow an object with only her eyes. So holding your head completely still, just follow this, okay? Good. Next, I'm going to dim the lights, and I'm going to have her look at a distant spot on the wall over there. And I'm going to check with my pen light to see if her pupil constricts whenever I shine my pen light in there. Take down your glasses, please. Thank you. Good. Good. Okay. So both of her eyes, both of her pupils constricted with the pen light being shined in that, which shows that her pupils are equal reactive to light and accommodation. So next, I'm just going to have her use only her eyes to follow this object again, but I'm going to just go closer to her nose and see that her eyes cross as this object gets closer to her nose.
With my glasses on or off?
Off. Okay. Hold your head still. Use only your eyes to follow the object. Good. Okay. So now we know that cranial nerves 3, 4, and 6 are intact. Next, we're going to do the 5th cranial nerve, which is the trigeminal nerve, and she's going to clench her jaw, and I'm going to feel her masseter muscles. So clench your jaw. Good. Now open your jaw against resistance. Okay, good. And that shows that our 5th cranial nerve is intact. And if you can just blink for me, both eyes. Good. And close your eyes real quick. And can you feel me touch your face? Good. Okay. So next we're moving on to cranial nerve number 7, which is the facial nerve. And I'm going to have you puff out your cheeks. Good. Smile. and raise your eyebrows. Good. The facial movements are symmetrical on both sides, and there's no weakness on either side. So that shows that our cranial nerve 7 is intact, the facial nerve. Next, we're going to do the 8th cranial nerve, which is the vestibulocochlear, acoustic, auditory, and she's going to plug one of her ears while I whisper into the other, and she's going to tell me what I said. Okay, so plug that ear. Can you repeat it? Okay, and the other one. Repeat that, please. Okay, good. And then I'm going to have her just move her eyes back and forth for me to make sure that there is no nystagmus. So again, keep your head still and follow this object with only your eyes. And the eyes are both moving symmetrically. There's no nystagmus noted. So that shows cranial nerve 8 is intact. Next, we're going to move on to the cranial nerves 9 and 10, which are the glossopharyngeal and the vagus nerve. So I'm going to have her open her mouth and say ah, and I'm going to test her gag reflex, which I can't really do at this moment. I don't have a tongue blade, but that's how you would assess for that. And then I'm going to have her stick out her tongue and see if it's deviated to either side. So can you please open your mouth and say ah.
Ah.
Her uvula is centered. There's no issues there. Now stick out your tongue for me. Good. And her tongue, when she sticks that out, it is straight. It's not deviated to either side, so it shows both cranial nerves 9 and 10 are intact. Next, we're going to move on to the cranial nerve 11. She's going to shrug her shoulders, and then she's going to turn her head against resistance. So shrug your shoulders for me, please. Good. And try it again. Good. And turn your head towards my hand. Good. One more time. Good. Cranial nerve 11 is intact. And lastly, we're going to move on to the hypoglossal cranial nerve, and she's just going to stick out her tongue again. Okay, good job. So all of her cranial nerves are intact. So I'm going to assess her mouth at this point, and she's already shown that there's no deviation to her tongue or her uvula. I'm just going to check her gums and make sure that her teeth are in good condition. So open your mouth again for me. Good. And then stick out your tongue. And I'm going to check both sides of her tongue and the top. And I don't see any lesions, masses, cracking, or anything like that. And her mouth is very moist, so we know that she's hydrated at the moment. Next, we're going to move on to her ears. So using my otoscope, I'm going to check her ears now. Since she's an adult, I'm going to use the technique pulling her pinna up and back. Okay, so this ear canal is clear. There's no foreign body noted, no buildup of cerumen, and her tympanic membrane is intact. It's not bulging red. There's no fluid behind it, and it's a nice pearly gray color. Assessing the other ear, we're going to do the same thing. Pull her pinna up and back. And this ear is the same. There's no foreign body noted. There's no buildup of cerumen, no redness, irritation, drainage, and the tympanic membrane is a pearly gray color. Next, I'm going to assess her nose. So look up slightly, and I'm going to use this light to look into your nares. And there's no, again, foreign body noted. She declines any nosebleeds or extra fluid running through her nose or being stuffy. So there's no issues there. And are you able to smell at the moment? So cranial nerve 1, which is, it deals with sense of smell. That one is also intact as well. So next we're going to move on to inspecting the thyroid gland. So I'm just gonna palpate with my fingers, feeling for any nodules, masses, goiter, which I don't see any upon inspection. I didn't feel any with palpation. Next, I'm going to kind of get behind her and feel on either side. And I'm gonna have you swallow. Good. The thyroid gland rises and falls when a patient swallows. If there's a nodule on the thyroid gland and it rises with the thyroid when they swallow, it can be concerning, so you'd want to investigate that further. Okay, so next we're going to move on to her neck. So I'm just going to palpate her neck, make sure there's no tenderness. There's no tenderness noted. Are you able to look up and down and side to side with no pain? Okay. All right, so next we're gonna move on to feel all of her lymph nodes, and we're gonna start with the pre-auricular, which those ones are right here in front of the ear. And then again on this side. Then post-auricular, which is right behind the ear. And she will let me know if there's any tenderness with palpation, and I will notice with palpation if there's any swelling or like a hard knot, or if it feels rubbery. So next we're going to go to the occipital, which is right behind the post-auricular lymph nodes. And again on this side. Okay, and then we're going to move on to the submandibular and the tonsillary. Okay, and then we're going to go to supraclavicular, which is right above the clavicle here. And these should only be tender or swollen if there is an infection. And then infraclavicular, which is right below the clavicle. And again, these ones should not be able to be felt unless the patient has an infection of some kind. Okay, how did all those feel? Good. So the patient declines any tenderness with palpation of her lymph nodes. So what we're going to do next is assess her carotid arteries. I've already palpated them when I inspected her other pulses. So what I'm going to do is listen with my bell for a bruit. Okay, and it sounds good. There's no bruit noted. So next we're going to move on to her lungs, and I'm going to listen to her lung fields in the left anterior and the right anterior upper lobes. And she's going to take a deep breath for me. Good. One more. Good. And lean forward. Then we're going to listen to the apices of the lungs, which are the top portion of the lungs, and this is actually where tuberculosis likes to sit. So if you hear something up here, it warrants further investigation. So you want to make sure you're always listening to this area as well. Good. Now left upper lobe, right upper lobe, right middle lobe, left lower lobe, right lower lobe, and then the bases of both lungs. Okay, there's no stridor noted. All of her lung fields sound clear. No stridor, no crackles, rhonchi, wheezes, so it just shows that her lungs are working properly, and she has no infection at the moment. So next we're gonna do the breast exam. For the video purposes, we're not gonna actually do it, but I'll explain the process to you. So as the patient's sitting down, you're going to have them seated in 3 different positions. The first one is just where they're relaxed like this with their hands on their laps. And what you'll do is start at the nipple, and you can move in different motions, but you can do like a circular motion or kind of a lawnmower motion where you go back and forth. Either way, you start at the nipple and you move outward on the breast. You do this with both, and then you also inspect the axilla for any swollen lymph nodes. Next, the patient will sit with her hands at her hips, and you'll do the same thing, and you'll assess for like any dimpling, discoloration of the breast, any masses, tenderness, nipple discharge, and again, any swollen, hard, rubbery, or tender lymph nodes. And then her other one, she's going to sit forward like this. And again, it's just easier to see some dimpling this way. And then the patient's going to lie down. And when the patients lie down during a breast exam, it makes that breast tissue relax, which makes it easier to palpate for any abnormalities. And again, you can inspect and then palpate the axilla for any lymph nodes that are of concern, or just make sure that there's none swollen back there. And everything seems to be good. So she can sit back up. So next, we're going to assess her heart. We're going to listen to her heart in 5 different locations, starting with the aortic valve, which is the midclavicular second intercostal space. And you would do this in a regular patient exam unclothed, but for this purposes, we're just going to have her clothed. And she's going to breathe normally. Next, we're going to listen to the pulmonic valve, which is the left midclavicular, and it is the second intercostal space down. Erb's point is midclavicular, third intercostal space. Tricuspid is the 4th intercostal space down, midclavicular. When a patient has large breasts, you have to either lift them up so that you can feel underneath, or listen again while they're lying down. Then the last, we're going to listen to the mitral valve, which again, in a woman, it's like between the 5th and 6th intercostal space, midclavicular, so you would have to lift up her breast if she had larger breasts. In a man, you wouldn't have to do that. We're going to listen to these pulses again with her lying down. Actually, before you do that, the point of maximum impulse is actually where the mitral valve is, at the apex of the heart. And you can hear that when the patient leans forward. You're able to hear that much easier because that brings that portion of the heart even closer to the surface. So again, she's going to lie down, and we're going to listen to her her heart again this way. Same areas of the heart, and again, it's just easier to hear murmurs when they're lying down because there's more pressure, and so you can make sure that you're listening with 2 positions, seated and lying down. So the next thing we're going to do is inspect her abdomen while she's lying down. Again, a patient would be unclothed for this portion, but for video purposes, she's going to remain clothed. But when she's breathing, I can see that her abdomen rises and falls symmetrically. There's no paradoxical movement. Her belly is round, but there's no distension or ascites noted. Next, what we're going to do is auscultate, and we're going to listen to all 4 quadrants and the renal arteries, the femoral arteries, and the aorta. and then the femoral arteries. And there's no bruise noted in any of those arteries, and all 4 quadrants are active, but they're not hypoactive or hyperactive. Next, we're going to percuss her abdomen. So when you percuss, you're going to use your fingers, and you're going to do like a flick of your wrist onto your middle finger, and you're going to listen to the sound that it makes. If you do it over like a gassy area, it should sound excuse me. It should sound like a tympanic sound, and then when you percuss over the liver, it should make like a dull sound. Okay, now percussion over the liver. It makes a little bit different of a sound, and by doing that, you can assess the size of the patient's liver, and if there's any masses and how big they are. It should not extend beyond the rib cage either. So next, we're just gonna palpate her abdomen in all 4 quadrants, assessing for any tenderness or guarding, any bloating, firmness, masses or anything like that. And then we're gonna do it a little harder, assessing for the same thing. And the patient declines any tenderness or masses, declines nausea, vomiting, diarrhea. She didn't have any guarding or grimacing while I was palpating her abdomen. So you can go ahead and sit up. So next we're gonna do her deep tendon reflexes, which for this you will use a reflex hammer, and you will use you'll check her bicep area, and you would hit right there on her bicep. And it's not so much about the movement of the arm or the extremity that you're checking. It's more about the flinching of the muscle, making sure that you're hitting that and that reflex is working. So you would check on this area. Over on this side, then the radial, okay, and then the patellar, and you're just going to relax your legs. And then you would do the Achilles, and the patient will relax their legs, and their foot will be resting. So it doesn't normally work if the patient is tensed at all. And all of her reflexes are normal and equal on both sides. Next, we're gonna inspect her neurofunction. So she's gonna follow my finger, and she's gonna touch her nose and then touch my finger as it moves. Okay, so touch your nose and then my finger. Good, now do the other side. The patient did that fairly well. There was no odd movements or hesitation. She didn't miss my finger, indicating a neuro defect. So then we're going to look at her symmetry with her squeezing my fingers, and chest her strength. So it's equal on both sides, it's strong, 2+, and symmetrical grip on both sides. One's not stronger than the other. For her musculoskeletal assessment, we're just going to make sure her range of motion is within normal limits. So she's going to raise her arms for me, and then up to the sky, and put them back down. And then this is where you'll just test abduction and adduction, flexion and extension, just to make sure that all the joints are working properly. So she's going to move her elbows like this. Okay, and then she's going to stand up, and just lift her leg, and again, and that just is checking her knees and her hips. And then for her other neuro, we're going to have her walk to the chimney and back. She has a steady gait, and we're gonna have you walk one more time over there on your tippy toes and then come back on your heels. Good, the patient did well. And then lastly, you check the dermatones, the cervical and the lumbar dermatones. So she's just gonna close her eyes for me, and I'm gonna touch a part of her body, and she's gonna tell me where I touched.
Arm, wrist, face, knee.
Okay, good. So this physical assessment is all finished, and the patient did a very good job. Thank you.